Hi, everyone. I'm John Whyte, Chief Medical Officer at WebMD. I've been interviewing a lot of physicians, scientists, government experts over the last 3 months about the impact of COVID. But they're not the only ones that are making a difference in terms of how we battle this pandemic. There's a lot of non-health professionals that are also making a difference. And one of those persons is Kenneth Cole, fashion designer, activist, philanthropist. He's been keenly involved in public health issues for 30 years, always focusing on diversity and inclusion. First it was HIV, now it's mental health. Kenneth, thanks for joining me.
Thank you, John.
You recently founded the Mental Health Coalition, which includes 36 advocacy groups, business leaders, celebrities, all trying to fight the stigma of mental health. Why now, Kenneth?
So I had spent a lot of years living through another pandemic. Earlier on in my business career, HIV, I got involved. My first campaign against stigma for HIV in 1985, as AIDS was just being given a name, and there was a devastating virus that was killing people around the world, mostly in New York, men, young gay men, and people didn't understand. They couldn't get their arm around it. They quickly learned how to contain it, but not how to cure it. So we did a campaign called "We All Have AIDS," and we aligned all these extraordinary individuals. Flew to South Africa with Mark Seligman. We photographed Nelson Mandela, Zaki Ahmed, Desmond Tutu. Went to Los Angeles, photographed Elizabeth Taylor, and Elton John, and Tom Hanks, who had just done his film Philadelphia. All these people who had a voice in this pursuit, and aligned everybody around the notion of stigma. That was always the rallying point. So that's what we did, and we did all Vanfar's branding, marketing, and we tried to destigmatize HIV for a lot of years. I had stepped away from that about 1.5 years ago. Was with the people from NAMI, because the company was doing a stigma-free initiative on mental health, because mental health, we've come to believe, is a way bigger pandemic than HIV. And that kind of drew me into this.
You've talked about that 1 in 4 people are impacted by mental health, but really 4 out of 4 people are impacted by mental health.
Yeah, so the World Health Organization says 1 in 4. We say, if you consider people that you love, and people in the family, in the community, in the workplace, everybody's living with mental health issues. And everybody's contextualizing it on a daily basis, and it's overwhelming. And 2/3 of those people are living in the shadows, because they don't know how to confront it. They don't know how to deal with it. The stigma for mental health issues, as pervasive as it is like it was with HIV 20 years ago. It's so bad. So, why don't you, or would you consider working on an initiative to destigmatize mental health? So I went down this road with the understanding that maybe we work on an initiative, maybe we do. NAMI says it will support you. And then I came to realize, what, this would require a culture shift. It's so big an undertaking. And it would require people holding hands, kind of circling the wagons, agreeing that, that we all kind of rally, that we all kind of hold hands, go down this road together. Because, I spoke to 5 different psychiatrists and asked them the same question. What is it? Define for me depression. I got 5 different definitions. And what is bipolar? I got different definitions. So there isn't the traditional clinical vocabulary today is so diminishing and so stigmatizing in and of itself. And so how do you come up with
wanting to make it non-clinical in a way?
Yeah, how do you empower people to talk about how they feel? Those 2/3 who are existing kind of by themselves in the shadows. How do you empower them with a platform by which to talk about their mental health as they talk about their physical health? And the truth is, when someone says, "How are you?" it's the two they work together, because unless you're not well unless both those parts are aligned. So we started reaching out to other mental health organizations, and eventually almost every important mental health organization in the country agreed to support us and to align. And eventually we formed what became known as the Mental Health Coalition.
You've been talking about the power of storytelling. One component of this is an effort that you have with Kendall Jenner about how are you doing really with people sharing their stories on Instagram. Why is storytelling so powerful, Kenneth?
Storytelling, why is it powerful? I'm not sure I can answer that question, the why, but I mean, it's been, scientists have discovered that there is a chemical reaction in the brain, and people respond powerfully, meaningfully to telling the stories and to hearing other people's stories. And it lets down their natural resistance and guard, and creates pathways to healing in effect. So what we did was we set up, it was actually an initiative that was kind of that was run, and it still is, by my daughter, Katie, who built the platform. And it asks the question most commonly asked in every country, in every language, everywhere in the world, and most rarely answered: how are you really? And we encourage you to answer that and share your emotions with your community, and do it on one of the social platforms. I did it, and I had done it before publicly, and it's very therapeutic.
I first met you 15 years ago when I was working on a public service announcement for HIV for World AIDS Day. And I still remember 15 years later, you said to me, John, it's more important what you stand for than what you stand in. An intentional pun, as someone who makes shoes. But why get involved in this now? Why put forth your energy?
I didn't intend to be here. So it wasn't a road I was on, and I just found myself here. And I realized that this opportunity was so massive and so compelling, and that we could make an impact somehow. We could impact people's lives in a meaningful way. And then, so we had started down this road, and then COVID hit us, and we were going to do something in October on Mental Health Awareness Week, and we realized that we didn't have the luxury of waiting till October. But if we're fortunate enough and we're able to put tools out there that people can be helpful to people, even in the smallest way, then it's just a wonderful, an extraordinary opportunity that we would have had to help people.
What do you hope to accomplish from this coalition?
You know what? The coalition, I know that 1 + 1 in this space equals more than 2. And I know that if we all kind of are aligned on a path, that we can change culture. That weekend when we did the How We Really Challenge with Kendall, and she challenged Kim, her sister, Kardashian, and Hailey Bieber and Justin, and we reached 200 million people in like 24 hours, 48 hours. It's astounding the amount of impact you can make today and the amount of people you can reach.
You always say to me, you're not a public health expert, you're a stigma expert. But you're involved in these issues, right? HIV, before it was popular to get involved with, you're getting involved in mental health exactly at the time where we need more resources. Aren't stigma and public health really related?
They are, but stigma isn't just exclusive to mental health. But I'm in the branding business, and that's what I do. That's what I do every day, and that's what I do in the ordinary course. That's what enables me to do all this other stuff. So, and it's something that I understand intuitively. So, and that's really what I did at AMFAR, and that's what I did most of my work in HIV. And I became a UN AIDS ambassador, also with the goal of helping them realize their goal of ending AIDS by 2030 as a public health crisis. It's what I do. I'm good at putting myself in other people's shoes, hoping that they'll also want to put themselves in mine, pun intended. All I often want to do is help shine a light, is promote their efforts, shine a light on their important work. And people are going to embrace that. There's no reason they shouldn't. And at the end of the day, by aligning people and create transparency, you find leverage and synergies and opportunities that each of them help each other in the ordinary course. And duplicative initiatives ultimately become identified, and opportunities are also realized. So, and that happens, from using a business approach, and which isn't typically one that's brought to healthcare. I don't know, but and then branding and marketing, because that is what it's all about. That's how you connect with people today. So you motivate, inspire people.
Well, we certainly need new approaches and new ideas to address this mental health epidemic that we're having, along with the COVID infectious disease epidemic. Kenneth Cole, I want to thank you for all that you've done for HIV. I want to thank you for what you're doing for mental health. And thank you for sharing your insights today into what we all can do to improve the situation.
Thank you, John, and thank you for what you do. It's been a privilege to stay in touch over the years, and what WebMD does and how it facilitates access to important resources is also so vital, and especially in a time like this. So I thank you and look forward to being in touch.